going to be doing a peripheral vascular assessment on my patient. First, we're going to take a look at all of her pulses and see if they're equal. And I'm doing the popliteal right now. And the pedal pulse. So her radial pulse looks like it seems to be about 72. Now we are going to auscultate the temporal and the carotid and subclavian. So I obtained blood pressures on my patient on both the left and right arm, lying, sitting, and standing to see if she was orthostatic. So the left arm lying read 121/67, and then standing read, or sitting read 118/77, and then standing read 125/79. On her right arm, she was lying and it was 122/69, and then sitting was 117/68, and then standing was 122/77. So she was not orthostatic, and her heart rate when she stood up did not jump any higher. So sometimes when we do orthostatics, it'll tell us if the patient is dehydrated, and if they get dizzy when they stand up, sometimes it'll tell us maybe they need some fluids. Now we are going to check the jugular vein pulsations and the hepatojugular reflex. Okay, so when the liver was palpated, the jugular vein filled up, and then whenever it was released, the blood was released from the jugular vein. So that is a normal finding for this patient. We were also able to feel the 3 pulsations in the jugular vein as well. Now we're going to take a look at the patient's nail beds and check her capillary refill and look at her skin and see if she has any masses, lesions, or abrasions. So her cap refill is less than 1 second. If the patient wants to just kind of show us her fingers, Her fingers are a good color, they're pink, no paleness, which shows that she has good circulation. And we're also going to check her feet out. We're going to check her cap refill on her feet and show that she has good cap refill, less than 1 second, and they're warm, she doesn't have any lesions. We're also going to take a look at the patient's arms and legs and see that they are warm to the touch and they're smooth. She doesn't have any abrasions or lesions that we can see, and on her legs there's no varicose veins or any lesions or palpable valves on her legs. Do you have any concerns about your circulation or your skin texture? We're going to take a look at the patient's abdomen. We're going to palpate, look at the texture and feel if there's any masses, hernias, or anything like that. Do you have any concerns about your abdomen today?
No.
Any bowel problems recently?
No.
Okay. So I looked at the patient's stomach off camera. There's no lesions. The color is within normal range. It is warm to the touch. I also palpated her stomach and noted that there was no hernias or masses that I could feel. Her abdomen is symmetric on both sides. Her umbilicus is centrally located. It is inverted. There's no lesions on her abdomen. Her abdomen rises and falls with each inspiration and expiration. I'm going to take a listen to her bowels and see if she has bowel sounds in all 4 quadrants. Okay, so now I'm also going to palpate all of her organs in her stomach to see if I can feel for her liver and spleen and see if any of them are tender. And if she has any tenderness upon palpation, then she'll let me know. Okay, so her spleen was not enlarged, there was no tenderness, and her liver wasn't enlarged either. We're going to feel for the patient's aortic artery, her iliac artery, and then we'll do the femoral artery off camera. We're also going to listen to see if she has any bruits, and then we're going to auscultate the spleen and see if there's anything heard over that. And then we're also going to percuss the patient's abdomen to see what we hear. For this patient, there was no bruits heard. I could hear her aortic and her iliac arteries